Good day, sir. I'm Zoe, one of your physical therapists for today. May I know your name? Okay, how about your date of birth? Okay, so for today's session, sir, I'd like you to know that this will involve me touching certain parts of your body. Would that be okay with you? Okay, so to start, I'd like you to remove your shirt and remove your shoes and then wear your comfortable shorts. So assuming that the patient has removed his shirt and shoes and is wearing the shorts. So now, sir, I need you to stand upright and then look straight ahead. Relax your shoulders and dangle your arms at the side. Okay. So for the next procedures, we will not be telling the patient that we will be assessing his posture so that he will not be conscious of the way he stands and so that we will be able to get accurate results. So first, we'll be assessing for the patient's frontal plane. So we will be checking if the patient's head is rotated or tilted towards one side, and then we'll be checking if the imaginary line from his nose towards his manubrium is straight, and then we'll also be checking if the patient's shoulders, both shoulders, are level. And then we'll be checking if the angle of the clavicle are the same, and then we will also be checking for the height of the patient's nipples, if they are of the same level. And then the assessment of the height or the level of the nipples will only be assessed in male patients and not in female patients. And then we'll be checking and comparing both iliac crests. So in this part, we'll now be telling the patient, sir, I'll have to touch you in this part of this examination, okay? Okay. So I am now checking if the iliac crests are level. And then I will also be checking for the level of both anterior superior iliac spines, okay? And then now we will have to check if both apex of the patella are of the same level. And then we'll also be checking if one or both of the knees of the patient are rotated inward or outward, okay? And then lastly, for the anterior or for the frontal plane, we'll be checking if both medial malleoli of the patients are of the same level. So now, sir, I need you to turn towards your right. Okay, very good. Now we will be assessing the patient's sagittal plane. So in order for us to do that, we will be checking if the head of the patient is excessively positioned anteriorly or posteriorly. Okay, and then we'll be checking the lateral plumb line, which is composed of the patient's earlobe towards the patient's humeral head. So we'll be checking if it's aligned. And then I will also be checking if the shoulders are protracted or retracted. And then I will be checking for the presence of the cervical lordosis, thoracic kyphosis, and lumbar lordosis. And then next, I'll be checking if the patient, if the pelvis of the patient is anteriorly rotated or posteriorly rotated. And then lastly, for the sagittal plane, I will be checking for knee hyperextension. Okay, so I need you to turn towards your right again, sir. Okay, so now we will be checking for the patient's posture on the posterior view. So once again, we'll be checking if the head is rotated towards one side and then or tilted towards one side, and then I will be checking for the lateral shifts of the spine if there are any or if it is just straight. And then I will be checking level of both acromion, okay? And then I'll also be checking for the scapular spines if they are on the same level, and then I'll be checking for the inferior angles of the scapula if they are also on the same level. And then I'll be checking for the distance between the medial borders of the shoulder blades from the spine if they are equal. And then I will be comparing both iliac crests again. So sir, I will have to touch you again, okay? Okay, so I'll have to compare the iliac crests again, and then also the posterior superior iliac spine. Okay, I'll once again be checking on them. And then I will also be checking if the patella of the patient or if the knee on the back part of the patient is also rotated inward or outward. And then I will also be lastly checking if both medial malleoli of the patient are of the same level or if one or both are excessively rotated inwards or outwards. So, sir, you may now face me. So that would be all for our assessment, for our postural assessment for today. Thank you so much.